This is Steve Woodruff with Impactivity. Pharmaceutical companies and individuals in pharmaceutical companies are wrestling increasingly with the whole issue of what do we do about social media? But in many ways that's the wrong question to ask. We don't worry initially about social media or specific platforms like Facebook or Twitter. We don't look at the current trends. What we have to look at is the trend currents. Those forces that are shaping society and technology and communications in such a way that social media becomes simply a part of this larger whole of networked communications. And so I suggest that as we talk about social media in pharma, we begin to escalate the conversation to these larger scale issues of peer-to-peer communication, of community formation in a digital network, of the freedom of self-expression, and of the reality of disintermediation. These are the forces that will lead us to be using social media because they are much larger than things like Facebook or Twitter or YouTube at the moment. So let's talk about it, but let's talk about it in its bigger context, because then we get the clearer picture of why a pharmaceutical company inevitably must be involved in network communications. This is Steve Woodruff with Impactivity. Thank you for listening.